Thank you, Jane, and thank you, Pam, for setting this all up. I'm going to switch gears a little bit from something really cool that's being done by someone else to something really cool that's going to be done by all of you with us. And I think one of the great things about this meeting is that this is a chance for people who should have met each other 2 decades ago to meet each other, to get together. And so at one point in the middle of my talk, I want you to be prepared for this. I'm going to ask you to turn to someone near you that you've never met before and introduce yourself. Because what we're going to do is I want to have this be a meeting where we walk out of here and do something instead of just talking about it. Because we've all been to lots of meetings where we all sit and talk and we sing Kumbaya at the end, and then we go back to our universities and do all the stuff that we have to do otherwise and forget about it. So we're not going to do that this time. So as you've heard, I'm a pediatrician, and my training as a pediatrician is to take complex science and turn it into easily understandable action steps for kids and parents. And that is the role that I bring to this. And talking about research methodologies, I'm going to go back about a little over a decade, now almost a decade and a half, to something that a mentor to all of us, either directly or indirectly, John Wright, said in 2001. And that was that despite the volume of literature on TV use, available studies generally have one of 2 weaknesses: poor quality measures. Hey, so how much TV did you watch yesterday? I study this stuff, and I couldn't tell you how much time I spent in front of a screen, how many screens they were, what I was paying attention to, et cetera, yesterday. Or small convenience samples. This is the problem we have to solve. And guess what? It's a whole lot harder now than it was in 2001. Because this is the reality of the adolescents that I care for and that many of us are raising. And we have to take into account now way more than that television in the living room. We have to take into account the concept of multitasking and of ambient exposure, the foreground, background we've talked about. And it's more complicated than just dad watching a football game in the background while a toddler is playing with blocks. It's also us walking through airports and shopping with a screen on the cart, and moms in the playground doing this, pushing their kid on the swing. 73% of parents are on devices during meals in one study that's just recently been done. And 30% of the time, parents are with kids in the playground. They are distracted by devices. When parents are distracted by devices, those kids are greater than 3 times more likely to take risks and get hurt. 200,000 visits to the ER every year for playground accidents. And it has to take into account mobile media. We can no longer make device-centric studies because we are moving through these spaces with these media in our pockets and with media all around us. And I don't need to tell you the life of teenagers has dramatically changed because of devices. We can no longer say to them, so how much did you text yesterday? Or how much did you use the telephone or watch television? We have to rethink exactly how we are studying this. And what we have come to with the studies that we've done, but also the studies that many of you have done that we have pulled together, is to rethink this not as a vector of either education or harm, but as the environment in which they're living. This is the air they're breathing and the water they're drinking. It is not going to go away. No matter how much we want it to, we cannot restrict it, we cannot stop it. So we need to learn how to live with it and to use it for the positive outcomes we desire. And because it is so much a part of our lives, every aspect of our lives, it has been studied by many disciplines. And one of the great things about this meeting is many of them are here in the room. And that's why I want you right now to turn to someone you don't know in arm's reach and introduce yourself. Now, remember where you were in those conversations, because those should continue once we get out there after my talk, but I actually have to get to the end of it for you to get back out there and continue. But one of the great things I'm hoping will come out of this is that we will continue these conversations, not just in, a casual way, but say, how can my discipline enrich your discipline? How can my perspective help you? One of the things that I realize, and this is something that is discussed in a paper that will be coming out in the wonderful double issue for the 10th anniversary of the Journal on Children and Media, is the idea that each discipline not only brings a new perspective to things, but brings its own bias. And I'll tell you, the bias of pediatricians from the beginning, our job is to keep healthy kids healthy. So our bias is, how can we keep media from harming children? But the bias of an educator is, how can we teach children with media? And it's not a bad thing. That is our discipline. That's what we do. But we need to recognize that, and we need to come to it. And one of the things that we can do working together is that cognitive dissonance between them can actually increase the rigor for each of us, because we can bring in the strengths and limitations of another discipline with another perspective and actually add dimensionality to what is, after all, something that is pervading all of our lives and our behaviors and changing our behaviors. So about 13 years ago now, we founded the Center on Media and Child Health that Jane mentioned for this very reason, that we understood that, as Vic Strasburger, who is here, said in 1989, while writing policy statements for the American Academy of Pediatrics, which, let's face facts, get everyone's attention right up to the front page of the New York Times, is that pediatricians weren't doing this work. It's social scientists who are doing this work. And so, contrary to the typical academic structure, I said, let's start a place where we have everybody playing together. And so we have psychologists, anthropologists, human ecologists, social workers, all doing research looking at this. And that is, I think, the future for how we are going to study this, which is we have to come together and, instead of doing little narrow studies, understand the whole of this experience from multiple perspectives simultaneously. And we approach it from the idea of educating and empowering children and their caregivers to create and consume media in ways that optimize children's health. Create, even at that time, 12 years ago, they weren't doing that much of it, but look what's happening now. There are kids tweeting and Snapchatting and Vining all the time. And they need to understand the implications of that and how it affects them. And we approach this from 3 angles: investigation, translation of the research to those who really make a difference, the parents, the teachers, the clinicians, and who are really interfacing with the kids, and innovate. How can we use those media to enhance the lives of children? And as a service to all of you, and I really hope you'll use it, Jane mentioned this, we have a database of research. As far as we know, it is the only collection of good, rigorous science from at least 15 disciplines in one place that you can use to build your bibliographies as you approach something, but to really understand across disciplines what's going on and what we understand. We also have, that's our website where you can access it, and we also have a research blog. So your work is going out to all of us when it comes out. So we're constantly putting out this blog as papers come out so that people can stay updated. So what do we need to do now in 2015 to study this immersive environment through which young people are moving? It needs to be interdisciplinary. That's why you all got to meet each other. And hopefully these relationships will continue and thrive and enrich us all. We need to standardize our measures and our nomenclature. It is really, really hard when you look at, say, the media violence literature, because everybody uses slightly different measures. And we need to move beyond that to be able to do the kind of systematic reviews and meta-analyses that are necessary to really understand what's going on in these things. But we've got to talk to each other and we've got to agree on things. And that's not the academic way, typically. We do our own things in our own shops. We have to bring in neurodevelopmental and individual characteristics to this. We heard from a gentleman that works with kids on the autism spectrum. But even less extreme than that, Patty Valkenburg's work that looks at differential susceptibility, that looks at the idea that how come millions of kids can play Call of Duty, but some kids pick up a gun and act on it. And we need to start to understand what those triggers are, what those characteristics are that bring certain kids to be at greater risk. We need to use mixed methods. Numbers can't tell us the whole story. We have to bring in qualitative measures. We have to get the nuances because this is ultimately human experience that we're studying. Human experience in a new environment. We need to have bigger studies than the 2 that Jeremy told us about in one study. We need to have representative studies. And it's wonderful that he's going to go out to flea markets and stadia and things like that to actually get to the people. And we need to use the technology, much of it the technology we're studying, to scale up, to be able to work with these tools as well as what we're studying. We got to bring the kids in. They are ahead of us. They are the so-called digital natives, and they will tell us what's important, and they will guide us to that. Use them to collect the data on their experience. Use them as key informants. We need to start doing very naturalistic studies, not studying individual devices and interactions because, face facts, individual devices are going to disappear. We're already heard people aren't buying televisions. What is a television anyway? Yesterday I was speaking to a group and a mom said she has this beautiful media room with a big flat screen, 4K television, and her daughter and her friend were cuddled on the couch in front of the screen, cuddled together, watching YouTube videos on their phone, right? Because it's more than just what you're seeing and hearing. It's also the human interaction that occurs around it. And we need to understand that it's not about television. I mean, we can look at kids watching television and ask questions about obesity or violence or whatever, but then what do we do with that information? That is one slice of a very rich and complex life with a lot of other things going on. And now a lot of those things are other media things. So we can't just say, TV has this effect. We have to say, this is what happens to the individual as they move through these heavily media-saturated environments. So we need to study them as environments, not as a vector of either harm on one side or education on the other. But we have fallen into this kind of polarized view of it. Even the American Academy of Pediatrics has been painted as anti-media rather than pro-child. And that we have to break through that. We have to break through that kind of political tension and say, let's get the stakeholders around a table and roll up our sleeves and fix this. And we need to learn how to communicate those findings in accessible and feasible ways so that there's something to do at the end of it, something a parent can do, a teacher can do, et cetera. They can change behavior and improve things. So one of the research methodologies that has come out of that frustration, it also came out of a frustration from a group that was convened by Ellen Wartella and others back in 2004 to develop media effects hypotheses for the National Children's Study, which never happened. But what happened was we got a lot of people in the room who sat down and figured out we really don't have good measures for this. And a couple of colleagues and I walked out of that meeting and went forward to develop one new methodology that I'm going to tell you about now. But I also want to say the current issue of the American Behavioral Scientist, an issue that was edited by David Bickham and Ellen Wartella and myself, has a number of really forward-looking, including Patty's work, forward-looking methodologies as we try to tangle with this issue. So let me tell you about mine, Measuring Youth Media Exposure. This is something we piloted in Manchester, New Hampshire with the generous support of the National Institute on Child Health and Development. Thank you, Susan. What we were trying to do is change the point of measurement to the child. And so what they do is they have a smartphone that uses ecological momentary assessment and pings them at random intervals when they're awake and says, where are you? Who are you with? What are you doing? Are you using any media? What are you paying first, second, and third most attention to? It has a positive and negative affect scale. Are you happy, sad, nervous, anxious, whatever? And then they do a 360-degree video pan of their environment. So it picks up content and context of what they're exposed to. And as you might imagine, this generates a lot of data. And so the data management is actually very complex. But the other thing that's interesting is this is nested within 3 other angles at looking at this. This is done in an intensive 1-week data collection that starts with a standard interview about their health status and height and weight measurements, et cetera, and a recall estimate, what we have typically used, the how much TV do you watch, this, that, and the other, of what they did in the previous week. Then they go through this week, and this is, I won't go through in great detail, but every one of these little carrots is where they are pinged. This is the health status questionnaire done with audio computer assistant self-interview, so it's private. And for 2 days of the week, on Saturday and on a randomly selected weekday, they do a 24-hour time use diary from 6 a.m. till the following 6 a.m. So we get durations. At the end of that, they have a media use inquiry which basically looks at those 2 days that are very deeply studied by multiple methods, time use diary, ecological momentary assessment, and asks them what they recall of what they saw and did that day. And what this is getting at is not only to try to validate and understand how well those recall measures we've used for years are, but it's also to look at the issue of salience. If you remember playing Call of Duty, does it have more of an effect or less of an effect? So we're getting at this, sort of background, foreground, critical viewing thing. And then we follow them annually for their health status, year after year after year, and their media use year after year after year, with the idea that we're going to do, much like the Framingham Heart Study, follow effects of their lifestyle, including their media use, on long-term outcomes. Because we're all dealing with cross-sectional or very short-term results. We're not dealing with, will this kid who's playing Grand Theft Auto at age 7 steal cars at age 20? Or beat up hookers, or whatever, because we all jump to that conclusion. But is that realistic? And we need to know that. I am pleased to say that the province of Alberta has now decided that we are going to roll this out with 3,000 children across Alberta, which is the most wired of the Canadian provinces. 1,000 preschoolers, 1,000 school age, and 1,000 teenagers, and follow them as long as the oil sands hold out, I suppose. But the idea is to really get at what kind of media exposure they're having on their terms, having them show it to us, because we can't even anticipate what's coming down the road when Mark Zuckerberg gets those Oculus Rifts in every living room in 8 months, right? So it is flexible enough to be able to pick up stuff that we can't even anticipate and follow it out for real health and developmental outcomes rather than speculation. So I'm going to close with a call to action. I've not just made you meet each other. I'm going to ask you to do stuff. You've done the first one, but let's establish collaborations. Let's really make this happen. Let's find somebody whose work really interests us and push against that shyness and that academic competition and say, hey, what would it be like to work together? Not just across disciplines and across institutions, but around the world. This is a global issue. And we have much to learn from each other, because also other cultures responding to this in other ways may teach us something about how to handle this better. Let's use those different perspectives of the different disciplines to increase our rigor. Let's develop a consensus on measures and methods instead of saying, well, no, that's not really violence, this is really violence, et cetera. Let's just come to a decision that will make none of us happy, but at least we can agree on. Let's establish important new research questions. As a clinician, I have, in the past 3 or 4 years, become inundated with media-related specific problems. Is my kid addicted to video games? Are there unique media problems, media-related, media-caused or contributed, or are we seeing problems kids have had forever in this new environment, playing themselves out? In other words, is a kid who's going to porn sites all the time having a new problem, or is this a sexual dysfunction or sexual, development retardation that is being contributed to or enhanced by the environment, the easy access to porn? We have to develop methods that are comprehensive but nimble enough to follow the digital environment. And that's what we're attempting to do with MIME, which is how do you create something that's open enough to catch even the stuff we can't anticipate and put it in a context that can be studied. The other thing is that I want to encourage all of you to use our data, because frankly, as you might imagine, we are collecting more data than we have the time or maybe the research questions and imagination to really mine as well as we could. Let's use our technology to broaden and deepen our data. Let's use the fact that the kids are on their smartphones all day to collect that data. But also let's use technology like functional MRIs, which we're going to hear about more later. Let's use the technology of medicine. Let's use the technologies that we have even for things like surveillance to really understand what's going on, because those cameras are running anyway. Maybe we can use them for something better than just catching marathon bombers. Let's pursue longitudinal and naturalistic studies. There is a point, there is a real use for experimental studies, but we have to get out of the lab and we have to see whether that translates out into real life and how it translates out into real life so that parents, pediatricians, and others can interpret those observations and understand when kids are needing help. For example, I don't like the term internet or video game addiction because, first of all, it's relatively inaccurate, but it is also stigmatizing. And what happens is that instead of a parent coming to their physician and saying, my kid's playing Minecraft, which I call mind crack, by the way, Minecraft 4 hours a day, is this a problem? So we catch them farther up the slippery slope, not when they've dropped out of their third school or attempted suicide, as some of my patients have. And involve the kids. We have to learn from them. They are early adopters. They know this stuff. They also know their struggles. They know what's going on for them. And if we can make ourselves accessible to them, and if we can engage them in helping us collect these data, interpret these data, and then implement the findings, we will be much better off. Thank you for listening.